Good evening, good evening, one and all. This is Bishop Dr. Yutan Ling coming another weekly medical update. And I just would like to welcome one and all. If you're viewing right now, I ask you to go ahead and share this programming so that everybody out there can get involved and they can see and know what is going on with their immune system. This program is to enlighten one and all right? And that's the whole idea of our programming is to share with one and all so that you can, really get a good handle on your life and the system. So we've been spending time over the past weeks talking about the immune system, and we're going to keep doing that. I'm going to be doing that for a little while. So we want you everywhere to, make sure you get up to date. And this is a great time for you to be updated and get, up to speed on your immune system. So again, this is our weekly medical update, and we continue talking about boosting your immune system. We've been actually talking about some basic areas of the immune system and to give you the basics, and then we're going to actually probably, as you see number 3 on the screen today, we're going to go talk about how to boost the immune system. Actually, that's going to be left for our next talk together. But for now, we want everybody to make sure that you're up to date on the basics. So we're going to go on talking and sharing and make sure you got the basics down. So we really want this week to talk about a couple things. There's a couple common syndromes of the immune system. And what I mean by that, you can have either an overactive or an underactive immune system. When you have an overactive immune system, we'll see it cause many troubles. For example, allergies. Allergies are when your immune system are kind of overacting to, one of the antigen that it's presenting. And so you get a lot of, the body is fighting. So you get a lot of issues, with, for example, seasonal allergies. When the season is raging, the body is kind of acting, aggressively, and then you get a lot of reactions. So, of course, it can cause wild, strong response to allergens. So allergic reactions due to an overactive immune system can, really cause a really severe allergic reaction that then cause a lot of problems. That can happen to foods because of foods, medications, stinging insects, sinus disease, and asthma and eczema. So your body could kind of then overact to when these antigens are presented, and you may get a major reaction in the system. There's also when you have what we call autoimmune disorder. That is diseases caused when the immune system makes an overactive response and actually also destroys your own healthy cells. And then this, so therefore you have to get medications that are going to help to quell the allergic reaction. And they're found in, there's about as much as about 80 types of autoimmune systems that are out there. And they include like multiple sclerosis, type 1 diabetes, reactive arthritis, and various other things that we see. So these are the things that can happen when your immune system kind of overreacts and then actually cause the system to then attack even some of your normal cells. And then that leads to some issues. And in those cases is when, you have to be treated to try to quell that immune reaction, using various medicines. Those people who are on any of these medicines know what I'm talking about, like things to kind of, reduce their immune reactivity and their immune response. Then, of course, you can have, number 2, underactive immune system. And when the systems kind of perform in a lower manner than they should, and it's called what we call immunodeficiency. And it makes the people prone to infections, and they can prove fatal in severe cases. So when your immune system is depressed and it's not acting right, you're not able to overcome the various things that will then be introduced into your system. Now, immune deficiency can be caused by many reasons, including it could be inherited, or it could be a reactive to some kind of other treatment. For example, in people with chronic granulomatous disease or severe combined deficiency disease, there are these systems that are not reactive appropriately, and then you're so more prone to diseases. Also, as I mentioned, you can have a reaction to some medical treatment. For example, when you get chemotherapy, it causes you to be immunosuppressed. And it can also be, so therefore, it decreases your immune reaction. That's why when you're getting chemotherapy, you're at more risk for being exposed to other infections. Same thing can be caused by some diseases. For example, HIV or cancer, some of those can cause your body to be immunodeficient, and therefore you're not able to mount a good immune response when things happen to the system. So basically today I just wanted to point out those two things. You can have an hyperimmune reaction or an hypoimmune reaction, and either one can be a problem, and there's ways to take care of that. So when you are, have severe allergies, for example, your body's kind of overreacting to the antigen and you get a lot of more symptoms, and it could be underreactive and it's not reacting properly. So we want you to just have the basic understanding today, because next week and moving forward, we're going to go more specific on specific ways on how you can boost the immune system. So we'll give you more specifics and more specific direction and help you to be able to cope with all of the systems. But for right now, just understand that there are common syndromes of the immune system. You can either have overactivity of the immune system or underactivity of the immune system. Either one can lead to some various issues, and either one are caused and related to various chronic illnesses and diseases. So this is Dr. Lang, telling you today, just in general, remember, and we'll come back to this theme, is a key thing in the short term is to eat healthy, drink a lot of fluids, get enough rest, exercise, and that's going to go a long way. We will talk more specifics, however, over the next few weeks as ways to boost your immune system. So we will, get you kind of up to speed, up to par, and get everybody on the same wavelength. So everybody stay healthy, stay tuned, and we'll be back with you next week. God bless you. Stay healthy. Blessings, blessings.